So endometriosis impacts the physical and mental health of those with the condition, and that can last from puberty to menopause and also outside of menopause as well. So the impact may be felt for life. I've been through surgical menopause 3 years ago, and now they think my endometriosis has started to grow back. So even a hysterectomy will not cure endometriosis. So it is a chronic disease associated with severe life-impacting pain, and that's during periods, sexual intercourse, bowel movement, urination. You have chronic pelvic pain, abdominal bloating, nausea, fatigue, lower back pain, leg pain, depression, anxiety, and infertility. So as you can see, it is a pretty harsh condition. And like I said, it's not just painful periods that we suffer with from this. So many of us are misinformed about it, and that information is not readily available to us unless you go searching through the internet. Even when I first sort of heard the word endometriosis, I thought, I have heard of that before, but it's just a very, very rare gynecological condition, which, you know, doesn't affect many people. It won't be something that I've got. But when I actually got the diagnosis and started looking into it, I was shocked at how many women and those assigned female at birth actually suffer with this.
Today's guest is Amy Roberts, a passionate advocate for women's health. After living with endometriosis and adenomyosis that were dismissed by medical professionals for over 22 years, Amy has channeled her personal journey into powerful advocacy. She's committed to raising awareness, educating others, and challenging the systemic gaps in healthcare that impact women. Join us as we unpack Amy's powerful journey with endometriosis and the advocacy it's inspired. But before we dive in, I've got a quick 1-minute favor to ask, and that's to hit subscribe and join the 51% community on our website. It's completely free and it helps us grow, bring in more incredible guests and host events that truly speak to the health and wealth challenges we face. And also a quick important note, everything shared in this podcast is for informational purposes only. It's not a substitute for personalized medical or financial advice, so always check in with a qualified expert if you need support that's tailored to you. Amy, thank you for joining me today on this podcast. It's great to have you on. Now, this conversation is about your journey with endometriosis, and it's been an extremely long journey, I know. So I would love for you to introduce yourself, talk a little bit about who you are, and of course, delve into your journey. That would be great. Thank you so much.
Yeah, thank you so much for having me, Shreya. So I'm Amy Roberts. I'm 40 years old. I first started having symptoms consistent with endometriosis around the age of 13 when my periods first started. But unfortunately, it took over 25 years for me to actually get a diagnosis and to be taken seriously. So I've have for the last sort of 4 or 5 years been using my voice to try and advocate for those with endometriosis and other menstrual health conditions, because they're so under researched, so misunderstood, and there's so many stigmas still surrounding them. So I've been trying to raise awareness and basically help anybody that I come across. And if I can help one person, that is my goal. So yeah, thank you for having me and raising awareness of this condition.
No, absolutely. It's my pleasure. So, I just want to dive in straight away and ask really, what is endometriosis?
Yeah, so endometriosis, it's a lot of different definitions going around, and a lot of them, it's very frustrating that when the endometriosis is being reported so much more in the media, however, they're getting the definition wrong, I would think probably 75% of the time, which is really damaging to the awareness that all of the endometriosis advocates are trying to do. So the official definition is endometriosis is a systemic inflammatory disease characterized by the presence of endometrial-like tissue found in extrauterine sites. So that's outside of the uterus. So endometriosis has been found on every single organ in the body. So as you can see, it can impact your entire life. It's a lifelong impact as well. It's not just associated with painful periods. So the endometriosis cells create lesions that grow on the surface, or they can penetrate tissues on the organs. So like I said, anywhere in the body. It can also create adhesions, which are like sticky tissues. So it can pull all your organs together and pull them out of place, which causes, as you probably can imagine, a lot of pain for those who suffer with endometriosis. So as I said, it's a full body disease. It's been found on every single organ in the bodily system, including the eyes and the brain. It affects 1 in 10 women. However, we do believe it's closer to 1 in 7 now. So 1 in 7 women and those assigned female at birth. So endometriosis impacts the physical and mental health of those with the condition, and that can last from puberty to menopause and also outside of menopause as well. So the impact may be felt for life, which again, I think is quite misunderstood. Like myself, I've been through surgical menopause 3 years ago, and now they think my endometriosis has started to grow back. So even a hysterectomy will not cure endometriosis. So it is a chronic disease associated with severe life impacting pain, and that's during periods, sexual intercourse, bowel movement, urination. You have chronic pelvic pain, abdominal bloating, nausea, fatigue, lower back pain, leg pain, depression, anxiety, and infertility. So as you can see, it is a pretty harsh condition. And like I said, it's not just painful periods that we suffer with from this. The cause of endometriosis is unknown. So we still don't know what causes it. We don't know why people think there may be a genetic link. But again, we haven't done, there hasn't been enough research into the condition to make, to actually consider what are the causes. So there's also no way to prevent endometriosis. But its symptoms can be treated with medicines such as hormonal, like birth control, or in some cases, surgery.
Wow. Now, you know what? I didn't know that you could get endometriosis in any part of your body. I had no idea. I just assumed it was gynecological related, and that was it.
Yeah. And
so
I think that's, sorry, I was going to say, I think that's the main issue, is that we still, like, there still is that belief that it is just, you know, going to be surrounding your reproductive organs.
Yeah.
However, it's been, when I first had my first surgery, it was found all over my bowels. It was found in my rectum, inside my womb. I know people who it's been found on their kidneys, on their bladders. So yeah, it can affect everywhere.
Gosh, I just had no idea. I feel so like not stupid, but I actually feel like how, you know, I don't know, I just put 2 and 2 together in terms of it being a gynecological thing, and that is it. And you're right, because when I start doing a little bit of research, and I haven't gone into the depths of the research, but even the high level research, it just points to gynecological things.
Exactly. And this is, so many of us are misinformed about it, and that information is not readily available to us unless you go searching through the internet, trying to find the endometriosis advocates who are, you know, doing an amazing job at creating the noise around endo and really putting their voices out there and sharing their stories. But when I actually got the diagnosis and started looking into it, I was shocked at how many women and those assigned female at birth actually suffer with this. And I think we're really letting these people down. We're letting them suffer for, you know, 10 to 20 years. It's doing its damage to their bodies by the time they get their diagnosis. You know, it's affecting their fertility. It's a huge problem, I think, for the NHS. And I really think we need to educate our doctors better.
Yeah, absolutely. I mean, 1 in 7, that's a lot. You know?
And it could be even more than that. We just don't know. There's no accurate figures at the moment. Endometriosis UK does some amazing surveys and to gather data about the condition, and they're always in Parliament raising awareness about it. But again, you know, without medical professionals who believe us, take us seriously from the very beginning of our diagnosis journey, I don't think we're ever going to get an accurate view of how many people it actually affects.
Yeah. So you say that, okay, so endometriosis could effectively be present on any part of your body, on any organ. Now, how does that differentiate? So if I have if I'm having symptoms around my kidney area, or perhaps even your heart, could I even go down that road?
Yeah, well, there's thoracic endometriosis, which is mainly in the chest area and your lungs. Again, that could be extremely hard to diagnose because, as well, the symptoms of endometriosis overlap a lot of other conditions. So, for example, I was misdiagnosed with irritable bowel syndrome for 22 years because most of my symptoms were gastro. I had severe heavy bleeding. I had debilitating pain around my periods. However, outside of that, I would have consistent daily pain around bowel movements, and I would have very dysfunctional bowels and they'd be all over the place. So doctors kept telling me IBS, IBS. But even though I kept going back to the doctors after trying all the different diets, cutting out dairy, cutting out gluten, trying antispasmodics, I tried everything they gave me, nothing was ever improving. But they never looked at my medical history as a whole. So even though I kept reporting gastro-like symptoms, they never looked back and thought, oh, she also had hugely debilitating periods for her whole teenage years until we put her on birth control, which helped with the bleeding, but never helped with the pain. So I was then conditioned to believe that painful periods were normal. And every single doctor I went to in my early teens told me I wasn't special. It was just something that I had to deal with as a woman. And it wasn't until I got my diagnosis where my surgeon said, painful periods are never normal. It is never normal to experience pain. And I think as women, we are conditioned to believe that a certain amount of pain is normal, but it's not. Nobody is pain.
That is my absolute bugbear now, because growing up, like you said, I thought period pain was a normal thing and I had to just suck it up and get on with it. And I'll be honest, I didn't have severe period pain where I, couldn't function, but I had period pain, and I know women, girls that had like really bad period pains, but it was almost a case of, right, I'm popping some pills like ibuprofen as an example, and off I go to school or to work. And then I'll pop a few more throughout the day to help me cope with that. And never did I know until, in the last few years, that it's absolutely not normal to have heavy periods and painful periods. And I think that messaging has gone round the world, drilling it into women's heads that, pain is normal, it's fine, just mask it and move on.
Just move on with it, and don't make a fuss about it, and don't be emotional about it, is what I experienced during my early teens. When I was going to doctors, I was always being told, why are you so emotional? Why do you think that you're special? And I thought, I don't think I'm special for having this amount of pain. I just want some help and a bit of clarity. And also I think when I first started my periods, I was having to double up on the sanitary towels that I was using because of how heavy the blood flow was and the large clots that I was passing. And I remember being 15 years old, sitting on the toilet during a period, just wishing to be able to have a hysterectomy, because I thought, if this is what I'm going to have to live with for the rest of my life, I don't think I can. I don't think I'm strong enough to do it. And I think every time my period would come around, it was just like I would dread it. So I would dread 2 weeks of the month, would be dreading the next 2 weeks. And then the week before my period, all the pain would come, all the gastro symptoms would start building up. And then when my period actually started, it was like this implosion of pain and every single symptom you can think of. And I'd been passing out from the pain. I remember crying crying all the way through my periods. But every time I went to a doctor, they'd say, nothing we can do to help you. And I think what was I told? I was also told the pain was all in my head. I didn't have a high pain tolerance. So, doctors aren't trying to help us. They're literally trying to shame us a lot of time in my experience. And it's really difficult because once you have that experience with a doctor, you lose your trust in them.
Yeah.
So I lost complete trust. And even though I was going to 2 doctor's appointments, probably between 5 and 10 times a year, reporting the same symptoms consistently, nobody listened. It just felt like I was banging my head against the brick wall. And eventually I just stopped talking about it. I stopped talking to my friends, stopped talking to my family. I just thought, because I never had an answer. And I thought the people closest to me are going to now start thinking that I'm crazy, because some people said, well, the doctor's told you there's nothing wrong. So how many times can you go to a doctor to be told the same things? And I just said, but deep down, I know there is something not right with me. I just know it can't be normal to feel like this.
Yeah.
Every day of the month. Eventually it got to, I think, mid-20s is when it kind of literally took over my entire life, at least from sort of early teens to late 20s. I could enjoy some life and be able to go out and socialize and not be impacted as much. But I think from my mid-20s is when I realized that this condition or this pain that I was going through was literally going to impact every part of my life.
Yeah. So what changed then? You know, you said that obviously from the moment you started your periods, pretty much you were experiencing severe amounts of pain. You weren't listened to, of course you weren't, and that pain continued. And at what point did someone do something about it?
So, well, like I said, it continued all the way through my 20s. Still didn't have a diagnosis. Thought I was just dealing with IBS. So a lot of my jobs got impacted because I had to take a lot of time off work. Again, employers didn't believe me because I was being told it was just IBS. Relationships broke down.
I mean, forget that. You went through doing your exams and things in that pain as well.
I honestly don't know how I got through school and university, and even I don't know how I've continued working full time during this. I think again, women, we are conditioned to suck it up and carry on. Like, no matter how much pain we're experiencing, we're just told to keep our heads held high, carry on, don't complain, don't make a fuss, don't get emotional. Just literally, and operating in kind of a man's world, especially when I was in my early 20s, it felt like I was in a very male dominated job. So it was very, very hard to be upfront and honest about what I was actually experiencing, because I was embarrassed. I was embarrassed to talk to a male colleague about my bowel issues and, the pain I was experiencing through my periods, because I didn't think they'd understand, because doctors weren't understanding me. So how could a male colleague who'd never experienced that sort of understand anything I was saying? So I think it was when I got to my early 30s, I was living in Manchester, and I was in a very fast-paced job which required a lot of my energy and time, and eventually I realized I was burning out. There was no way I was going to be able to continue with the way things were going, and like I said, my illness was taking over my life completely. I couldn't really leave the house, I was cancelling plans, friendships got, relationships deteriorated because of it. So I thought, I need to move back home to Cardiff to be closer to my family who can actually support me. And at that point, they still weren't aware of how bad things were for me, because I'd kept it quite hidden. Yes, they saw some things, but I tried not to talk about it or make a fuss about it. So when I moved back in with my parents, that's when they could see what I was actually going through on a daily basis. And both of it, my mum and my stepfather, kept saying to me, this isn't normal, this isn't right. And I said to them, I know, I've been going to doctors sort of for the last 20 years, and I keep getting told the same things. And I was very lucky at that time that my employer offered private health insurance. So instantly I took that up, because I was getting weird back pain. So I was getting very weird lower back pain, where it felt like I was getting a buildup of pressure and then like bubbles going up my lower back. It was very odd. It didn't hurt, but it was just a very, very odd sensation. So I thought, right, I'll go to a gastro and through the private healthcare and hopefully get somewhere. So I went to the gastro, he ran a load of tests, and he said, there's nothing wrong here, there's nothing gastro, so I'm just going to discharge you. He said, like, the only thing I found is that you've got low B12 levels. So again, I was like, okay. So I took the additional B12, went back to work, and luckily my boss at the time was also experiencing some chronic health issues. So she really understood, and she recognized in me that something wasn't right, even though doctors weren't putting two and two together. So she was very supportive of me pursuing a diagnosis and just making sure that I was okay. So I think it was October 2019, things were getting progressively worse. I was unable to leave my house. I couldn't get out of bed. I couldn't shower, couldn't walk up the stairs, couldn't walk my dog. And I just thought I felt like this was the end for me, because I just didn't know. I thought my body was going into full breakdown mode. And I suddenly lost 2 stone in weight in a month because of how bad my gastro issues were. I was vomiting, I was nauseous most of the time, so really struggling to eat. So at that point, my mum was just like, we have to do something for you. We can't, because I was wasting away in front of her eyes, and she was so concerned about me. So at that point, I started speaking to a colleague on my team. And again, it baffles me to think that this is how I actually found my diagnosis. So I was speaking to a colleague about my symptoms, and he said, oh, everything you're talking about sounds quite similar to my wife. Do you want to have a chat with her? So I said, I'll chat to anyone, I'll talk to anyone about my symptoms, because I'm sort of at the end, I don't know what to do now. So we just went and had a coffee, and we swapped war stories, as we call them. And most of our symptoms aligned, apart from a few. So she had more bladder related issues, I had more bowel. But essentially, most of our symptoms lined up. So she recommended a doctor, a specialist surgeon who she had seen through the private healthcare at work, and said, go and see this man. He's diagnosed me with endometriosis and I'm having surgery. I was like, oh, wow. Well, I was like, I probably don't have that, though. And, already doubting myself, because I've been gaslighted so much over the years. So I always doubted my pain. I always doubted my experience, because so many people were telling me, you can't have that. It's, you're not this. So once she told me the name of my surgeon, I went back to my GP and I asked for a referral to the surgeon. And first of all, my GP said, absolutely not, we're not referring you. I know. They said, we want to do our own tests first before we do that. And I put my foot down and said no, because I'd already been in to see them a couple of weeks before about losing 2 stone in weight and having all these issues. And again, they just told me it was IBS, and I had to stop coming in and thinking it was something else. I've been told for 22 years it was IBS. And during those 22 years, not one doctor recommended going to see a gynecologist. So it was not one doctor ever said, oh, maybe we should just go and get you checked out. And over the years, I'd had extremely painful smear tests as well, to a point where I'd be screaming in pain, bleeding for days afterwards. And I reported this to all the nurses, and they always looked at me like I was making a fuss over nothing and just being dramatic. So they, my doctor's notes I think if you look at them as a whole, they build up a picture of endometriosis or a gynecological issue. However, no doctor ever told me to go and see a gynecologist. So by the time I'd spoken to my GP, I put my foot down and said, I'm seeing this surgeon. I don't care. I will find her. I'll get a referral one way or not. So eventually they said, okay, we will refer you, but we don't like doing it this way. And I said, I don't, that's fine. So went in to see my surgeon. So he at a private hospital. I know how privileged I am to have that opportunity to go and see somebody privately, because not everyone has that. And the waiting lists in Wales for endometriosis, you can be waiting up for 10 years for a diagnosis in Wales. Yeah. And it's 9 years in England. So it's shocking all over the UK, and it's similar times for Scotland as well. So yeah, I could have been waiting another 10 years, and I'm not sure whether I would still be here if that was the case. So I'm very lucky that I got to go privately. And I sat down, spoke to him, and within 15 minutes of meeting me, he said to me, I am 99% certain you've got endometriosis. We will need to do scans, and we will need to do a diagnostic laparoscopy so I can see what's going on. And I was just shocked that within 15 minutes of me giving him just quick medical background and everything I said to him, he went, yep. And he was shocked that I'd just been left. He said, everything that you've reported should instantly raise alarm bells for people that this is gynecological. So, which was extremely frustrating.
I mean, the heavy periods should have given it away, you know, and the painful periods, that's gynecological for, you know, it's like,
exactly,
that's not your brain.
I know. And I'd had a miscarriage in 2013 as well, and I had very severe complications after the miscarriage and was admitted to the hospital, to have an ambulance called for me and everything. Even then, they just did nothing. They again just looked at me like I was making a fuss over nothing, even though it felt like I was going into labor at the time. But then I found out I actually have another condition called adenomyosis, which is similar to endometriosis, but the tissue grows into the walls of the uterus. So I found out after I got my endometriosis diagnosis, I also had adenomyosis, which was causing all the issues I had after I had my miscarriage. So again, nobody was looking at me and putting two and two together. And I don't know how, because I've lived all over the UK. So it's not just one health board that did this to me. This is probably about 4 different health boards across the UK. So it's not just Wales, it's not just England. So this, you know, this is a systemic issue across our health board, across our NHS. So it's extremely worrying. So February 2020, I had my first diagnostic laparoscopy and excision surgery to remove stage 4 deep infiltrating endometriosis. So this is the worst stage of endometriosis because the endo grows very deep into the tissue of the organs, and it needs to be sort of extracted at the root. And not many surgeons are qualified to do this type of surgery. So there's 2 surgeries. There's 2 types: of ablation and excision. So excision is the gold standard for endometriosis surgery, but we do not have enough qualified surgeons to do these surgeries. So having a diagnostic lab looking for endo with just a typical gynecologist, they could easily miss endometriosis and misdiagnose you again and say there's nothing there. So we really need to get more of these specialist excision surgeons across the UK. These are the ones that we need, but there's just not enough of them. So I had deep infiltrating endo. It was found everywhere. He said that my organs were just sort of in a mass together. They're all stuck together. Nothing was moving. But I'd had an Sorry,
no. So is that because it wasn't diagnosed early enough and it had got to that stage?
Well, I think anybody can have so they've got stage 1 to 4 of endometriosis, and I think anyone can have any stage, but I do think because of how long I was left, it managed to grow more and, you know, take over my body, take over my organs. I'm not sure if it would affect the stage of endometriosis, because again, we don't know enough. So we don't know why some people have stage 1, why some people have stage 4. And again, your pain levels do not correlate with the stage of endometriosis you have. So some people could have stage 4 and never know, whereas somebody could have stage 1 and have the worst, you know, really debilitating pain. So it doesn't matter what stage you have. It's just you're just unlucky which stage you get, I think. And again, like we said, there's not enough research to say why somebody might have stage 1, why somebody might have stage 4. And like I said, there's also no correlation between stages and pain, which again makes it extremely difficult for women and those assigned female at birth to get their diagnosis, because stage 1, I think, is a lot harder to identify than stage 4. So, and then if they're in extreme pain and then they go to see a normal gynecologist and get an excision surgery, they may be more likely to miss it. So then we're again left again with no answers, and the damage is being done to our internal organs while we're waiting for these diagnoses.
I mean, I just heard recently, through one of my previous podcast guests who had silent endometriosis, never heard of it, again.
Well, again, and some people don't ever realize they have it until maybe they come to have a child, or
that's exactly what happened to her.
Or maybe, have a hysterectomy for some reason. And then it's like, oh, you've lived with this all along, and it will explain sort of all the reasons why you felt certain ways over certain periods of time. So it can be, it's extremely frustrating. But so in February 2020, I had my first surgery. But within 6 months of that surgery, I felt my pain returning to quite high levels, which I was shocked about, because obviously my surgeon, who is one of the top surgeons in Wales, said to me he'd managed to get everything. And in his experience, if you get everything, then it's low chances of it returning. However, I was not one of those lucky ones, and my endometriosis returned within 6 months. So I went for an internal ultrasound. And what I should mention also is that before my first surgery, I was sent in for a CT scan and an MRI. Both of those came back completely clear, nothing out of the ordinary. But when they actually went in, everything was attached to each other, adhered to my abdominal wall. So imaging is not a definitive way of diagnosing endometriosis. It is getting better, but it's still got a very, very long way to go. So nobody should rely on imaging to diagnose their endo. So if anybody has an MRI and a doctor says nothing there, you're fine, do not take that as the final answer, because usually they're wrong. And you should be going based off your symptoms and what it is doing to you on a daily basis.
And I suppose the internal camera can see exactly what's going on, because
and even then, endometriosis can look different in every single person. It's different colors, has a different appearance. So again, it can be missed so easily by somebody who is not trained to look for this. If it goes in onto the diaphragm, you can't always see the whole diaphragm. So it could be at the back of the diaphragm, it could be at the top. So if you're having cameras in through your abdominal wall, they're not going to be able to see everything. So it's extremely difficult. And I can understand why it is so difficult as well. And I think, doctors do have a hard time, but we need to train them. We need our NHS to be training them and making sure that we have excision specialists who know exactly what they're looking for. So February 2021, I had my second surgery. So a year later, I started then on sort of tramadol for pain management, because in the 22 years that I was going to doctors, the most they were offering me was ibuprofen and paracetamol, even though I told them how much that wasn't helping my pain at all. I think they felt like I was drug seeking, but in the whole 22 years, I just learned to live with my pain and try and, well, not learn to live with it, but learned how to kind of go through a flare and not let it break me, really. But when I found, after my second surgery, and was given appropriate pain management, that changed my life again. I was like, even though opioids are not ideal to be taking for long periods of time, it gave me some independence back, and I felt like I was able to do more things, go out with friends. And I couldn't believe that I'd waited 22 years for appropriate pain management either. And you think how many people's lives are being wasted by not being taken seriously. And I had my third surgery in July 2021, so the same year of my second surgery. And that it was at that point that they discovered that I had adenomyosis, because again, it's adenomyosis you can only officially diagnose. Well, I'm not sure if this is still the fact that it might have come forward a bit more. But when I was having it, the only way to diagnose adenomyosis was actually to have a hysterectomy and do a biopsy to check. But they could look for signs of adenomyosis, so that your uterus may change shape. It could look bulky. So I think mine was looking not in the greatest shape. So after my third surgery in July 2021, my surgeon and I discussed it, and we thought the best option for me would be to have a total hysterectomy. So that's where you remove the ovaries, uterus, fallopian tube, cervix, because we felt that the adenomyosis was no longer responding to the hormones I was taking, which was progesterone, and the endometriosis was just consistently coming back. And while hysterectomy is not a cure in any way for endometriosis, my surgeon hoped that by removing the ovaries, which is where my endometriosis would always start, that it would give me a bit of a respite between surgeries. And the problem is with endometriosis, if any microscopic endometriosis is left in the body, that's enough for it to reoccur and grow back. So even though you could have the best surgeon in the world, and he's not going to be able to get everything, and also there's places in your body it's really hard to remove, like the rectum, and unfortunately mine now keeps coming back through the rectum as well. So it is very difficult to operate on and to get everything out of there. So April 2022, I went forward with the total hysterectomy. Before that, I went through a round of egg freezing because I'd not had children, and my surgeon wanted me to at least have an option if that's what I wanted to do in the future. It's not something I've ever really considered because of how much the pain has impacted my life. And if I can hardly look after my dog, I'm not really sure how easily it would be to look after a child. So it's been, it's like I said, it's impacted every part of my life, and it hasn't stopped either. So yeah, after the hysterectomy, I woke up from the surgery, and from all the other surgeries, I would wake up and I would be in such bad pain that they'd have to give me a load of morphine. But after the hysterectomy, I woke up and I was shocked. I was thinking, where is the pain in my body? Like the pain that I've been so used to and conditioned to. I was just like, there's nothing there. And I felt amazing. And I thought, oh my God, I've just had major surgery and I feel like I could just, get up and dance out of the hospital. But it didn't last very long, unfortunately, that feeling of joy, because then surgical menopause came into it and really, really hit me like a ton of bricks. And again, I didn't get any support from doctors. I was dismissed by doctors because I was 37 years old going through menopause, even though I didn't have a uterus anymore or ovaries. Doctors were just very dismissive and didn't seem to want to help me.
But did they not inform you of that and let the other professionals know? I mean, that just doesn't make sense. Surely they put two and two together and be like, right, okay, this is surgical menopause and these are your options.
Yeah, didn't happen at all. My private surgeon wrote to them. They were always informed that I was having a hysterectomy. I was very good about informing my doctors what was coming up. So they knew I was going to go through a total hysterectomy at the age of 37, and that my body would be plunged into menopause. NICE guidelines say that doctors should be informing patients ahead of that procedure what they could expect, what support is available to them from their doctor's surgeries. And then afterwards, they should be monitoring you and, making sure that you've got appropriate HRT. And none of that happened to me I feel like it's because I sought help privately. It was like my NHS doctors didn't want to know anymore. I don't know whether they were offended by me going out to seek a different diagnosis, or they just didn't understand the diagnosis. I'm not really sure what it was. I did write a complaint letter to my surgery, explaining everything and how they made me feel. And they were great for a few months. And then again, it was then quickly forgotten about. So every single time I saw a private doctor, they would write to my GP explaining treatment, explaining what was happening, and every single time without fail my GP refused to follow specialist advice. They would not follow any of the treatment. Like, again, I was given tramadol and pregabalin, and pregabalin's used for nerve pain, so I got a lot of nerve damage from the surgeries, and they're both controlled drugs. They're, you know, and they're not nice drugs to take. However, at the time I needed them to get through life. And yeah, they're controlled drugs. GPs don't really like them. However, I'd had 2 private doctors, a pain management specialist and a gynecologist, write to them to say, this is what she needs. And then we need you to be the one monitoring, you know, and just keeping on top of usage. The fights I had to go through every month to get those prescriptions through my GP was just, it just made everything 10 times harder. They didn't want me to take tramadol. The doctor's receptionists were questioning my tramadol use when I would ring up to refill the prescription. And I thought, you're not even a medical professional. How dare you tell me how much tramadol I should be taking when I'm the one in pain every single day? And I, you know, I wasn't abusing those prescriptions. I was always very conscious as well as how much I was taking, because I was very aware of becoming dependent on these drugs. So I was always very careful with what I was doing. But I just felt like my NHS doctors just didn't want to help. They didn't want to know about me. I felt like I was a problem patient for them, and I was causing them issues and causing them extra work, which is how they made me feel. They made me feel like a burden. And I kept, like I said, I was very lucky that I had private healthcare. And I was able to use that in some instances, but menopause, private healthcare doesn't cover anything to do with the menopause. So I, again, had to go when I felt like my body was breaking down when I went through surgical menopause. I couldn't walk. I had arthritis in hands, fingers, knees, every single joint you can think of. I had hot flashes. I had night sweats. I was itching. I was depressed. I actually went to the GP at one point and told them I was having suicidal thoughts. And they told me, you'll feel better next week. So if if you're having issues next week, come back to us then. No referrals,
Wow.
no support, no follow-up from them, no medication. And then at that point, I was willing to take antidepressants because of how bad I was feeling. And I knew deep down why I was experiencing what I was, because I'd done my research ahead of surgical menopause. And again, you can never do enough research. I didn't know half the things for surgical menopause would happen to me that they did, because again, the materials are out there. People aren't having these conversations because there's so much stigma attached to it. So for example, vaginal atrophy is a huge symptom of surgical menopause. The skin starts to thin, start to break down because you don't have enough of the hormones. You need estrogen, you need testosterone, and you need progesterone. Or your ovaries produce all 3 of those hormones. But doctors only want to give menopausal women estrogen. And it's like, but we need all 3 hormones to have healthy bodies, and all 3 hormones play a major part in so many different of our bodily functions. So my vaginal atrophy got so bad to a point that I was unable to leave the house again, because I was unable to wear any clothes, because of how it would irritate it. It was painful. I was like, when I was going to urinate, it was extremely painful. And it was changing in front of me. It was changing as well. It looked different. It felt different. And it was very traumatizing for a 37-year-old woman to go through that and thinking, I don't think I'll ever be able to have sex again. You know, I'm never going to be normal. Like, what I feel like, I felt like an 80-year-old woman. I felt like my body had just jumped into being in my 80s. And it took over a year for me to see a menopause specialist on the NHS. Again, I wasn't made aware of them by my doctors. I was the one who had to go out and find these people. I also wasn't aware that at most GP surgeries, there are doctors who specialise in women's health or menopause. I was never offered an appointment with somebody like that. The only thing I was offered from them was a topical estrogen cream, which was not appropriate for somebody who had been plunged into surgical menopause at 37 years old.
Yeah.
And eventually I managed to see somebody privately, but again, that is a cost because private insurance doesn't cover menopause care, which is unfortunate because I think a lot of women could do with that support. And, you know, I can understand why they won't fund it through the entire period of menopause, but at least set us up for success by sending us to a menopause specialist who
I
can
think
give
some
us
companies are starting to introduce it
that.
that I'm aware of. I don't know how many, but I know some definitely do offer menopause support up to a point. Obviously, it's not a kind of, you know, every year you can see someone. It's almost, you know, you see someone that specializes in menopause and go from there kind of thing.
Yeah, and that's really important. And I think the problem with my and again, this is where I find that the NHS isn't equipped to deal with people like myself who have had 2 different chronic conditions which have affected a lot. Then I've gone into menopause. So they didn't want to prescribe me HRT because HRT may bring back the endometriosis. However, my body was breaking down. You know, the symptoms I was experiencing with menopause were really, really traumatic. I was isolating myself again. It was like I was going through the whole endometriosis journey all over again, just being left alone, ignored. And like I said, it took me a year to see somebody on the NHS. And when I went to see that doctor, again, a male, middle-aged doctor, he wouldn't answer any of my questions, which were my concerns about menopause. He just wanted to tell me what he knew about the menopause and wasn't listening to what my symptoms were or what I was concerned about. And when I managed to start talking to him about the vaginal atrophy, he said to me, this is just something that women deal with. There's no cure. You're just going to have to learn to live with it. Here is some like perfume-free soaps, and here's a topical estrogen cream, which should get things under control for you, but you're just going to have to learn to live with it. And I was shocked because at that point I'd done my research. I'm a part of lots of different menopause forums. Listen, you know, I follow Louise Newson religiously because she is the shining light in the UK for menopause and treatment of menopause. And I knew women who had had vaginal atrophy. I managed to reverse it, all saying it's back to normal. Couldn't even, you know, I don't even remember having it now because I had the right combination of HRT. So again, yeah, he wouldn't help me. So I thought I'm going to have to go back privately. So at that point, I think it was about a year into being in surgical menopause, I managed to find an amazing doctor, Dr. Helen Bayliss, who now also has an NHS clinic in Cardiff, which is fantastic because we've needed her for years. But I found her and we did blood tests. And my estrogen level at the age of 37 was 84, where normal levels are between 250 and 700. So I was being put at risk of osteoporosis, heart disease, cancer, you know, everything that could possibly be affected by joining into the menopause. I was being affected by it. I was being put at risk at that. And she was absolutely shocked. She was just like, I cannot believe you've been left to deal with. She was like, you must feel like you're dying. And I said, I do. I feel like my body is slowly breaking down, and I don't know who I am anymore. Couldn't remember what it was like to be me before the hysterectomy. So at that point, she was like, right, I'm going to completely overhaul your HRT. I'm going to give you what is considered by the NHS high doses. But again, I think they use that terminology to kind of shame you into what kind of medication you're taking, because again, NHS doesn't really understand HRT either. The amount of doctors who have told me I don't need progesterone because I don't have a uterus anymore is baffling, when progesterone does so much more than just protect the lining of the womb. It's good for your brain health. It's good for, you know, brain fog and bone health. It's so much that progesterone does for your body. So again, you know, just trying to find the right answers is like a minefield. So trying to find the right doctors who are going to treat you respectfully and properly as well, and give you all the right information, but then also finding the right research. It's a minefield out there. The amount of misinformation that is readily available to us. And it's hard. It's really difficult to navigate through that. And there's some amazing advocates who do really well on that, and they're, you know, really using their voices to campaign and get into Parliament and actually talk about our experiences, which I think is the most important. I think we need to listen to people who are actually experiencing this and living with these conditions and see how it actually does impact their lives. And like I said, it's not just your physical health, it's your mental health, it's, you know, your emotional well-being, it's your financial health, it's relationships outside of the home, it's your careers as well. Like, so many women are leaving work especially when they start going through menopause. I think like 45% of women leave the workplace due to menopause. And we should be supporting women at that point in their lives. Like, we keep saying, you know, we've got this huge push to close the gender pay gap and keep women in work longer, but how are we going to do that if we're not supporting them through the different life stages of menstrual health? Because it's from puberty, having children, you know, the conditions that might affect us in between, and then menopause. So there's so much that we go through, and I just don't think the NHS is as equipped as it needs to be to deal with women's health.
It's just too complicated, and you know, we can't be bothered. It's just too much. There's just too much, you know. But it's not too much if you just get it right from the beginning, you know. And I'm not saying everyone can have instant diagnosis. Some things take some time, but you know, 22 years, really?
It should not be taking 22 years. I think if somebody is coming in and reporting a certain number of symptoms, so for example, just heavy debilitating periods that stop you from doing your normal activities, that should instantly be a referral to a gynecologist. We're not expecting GPs to be experts in everything. It's not physically possible.
No.
But if they're not referring people to the experts, then how are they going to help anyone? And, you know, I understand that they've got to follow process. Yes, so try some medication, but if it's not working, don't just be like, well, you don't want it to work, or, you know, that's a lot of the comments I had. I had comments like, well, you obviously don't want the medication to work, so that's why it's not working. I was just like, how are you even saying that to somebody?
Yeah, look, you know what? I'm frustrated by, you know, the medication, because yes, there's a time and a place for certain medication, but when you have, you know, heavy periods or serious stomach cramps or whatever that thing is that's going on, you know, you're just simply masking the problem you know, and that is not going to solve the problem. And this is what will cause more kind of money, you know, spent for the NHS.
Yep.
You know,
exactly. And like you said, all treatment options for endo is just masking, apart from surgery where you are going in and removing the problem, however, but we know it reoccurs. But all the other treatment options for endo is just to mask symptoms. So you're still leaving people with the endometriosis inside them, which is growing, it's spreading, it's doing its damage to organs. It can infiltrate organs. So for example, it can infiltrate your bowel, and people need to have their bowels excised, and they lose parts of their bowels and they end up with stoma bags. So you're leaving people, and which is going to cost the NHS so much more in the long run.
Exactly.
If you think about it. And also another thing is, hormones aren't always the best treatment option for people. Some people can't tolerate hormones. So what do they have after that? And a lot of these drugs that are being introduced, you know, we keep hearing about these miracle drugs that I've just recently in the media, they're saying that this new miracle drug for endometriosis has been devised. It's not a miracle drug for endometriosis. This drug was made for treating prostate cancer. So it's not even made for women. It was made as a cancer drug to treat prostate cancer. So basically it puts you into a medical menopause. So it shuts down the reproductive system. However, they then, to help women from suffering from the menopause symptoms, they're adding in additional hormones. They're adding in progesterone and estrogen on top of this prostate cancer drug. It's called Ryeco. And yeah, it's not made for us. A lot of these drugs are not made for us. Another drug that was used to put us into medical menopause was a chemotherapy drug again. And yes, I know drugs can be used for different to treat different things. Like I said, I take pregabalin, which is actually an epilepsy medication, but it's really good for nerve pain. However, when I was put on this drug, nobody told me about the side effects and how difficult it would be to actually stop taking the drug. So it changes your brain chemistry, changes the way your brain receives pain signals, basically. And I've been on it for three years, I'd say. And I was on 400 milligrams of it, and I've managed to drop down to 50 over the last year, but I cannot come off from 50. Every time I try to reduce, all of my symptoms will just hit me like a ton of bricks. It's like I've been hit by a bus.
Yeah.
But nobody told me that it would be this difficult to come off. People have killed themselves by coming off this drug without the support from doctors. They've come off it too quickly. Again, doctors also don't know how to safely reduce drugs. When I told my doctor I wanted to come off pregabalin, they said to me, okay, well, we'll reduce you 75 milligrams every 2 weeks. That is way too quickly. You're supposed to come off pregabalin slowly, very, very slowly. So I actually spoke to a private pain management doctor who was helping me manage my chronic daily pain. And he said, under no circumstances should you be doing that. And no doctor should be advising you to do it that way. He said, what you should be doing is coming off 25 milligrams at a time, but reducing as you see fit. So for me, I've managed to drop 25 milligrams every kind of 4 weeks, and then it would kind of tail off, and I wouldn't be able to drop again for 6 months. So it's been a very, very long process. But yeah, like I said, the drugs aren't fit for purpose. I don't think. I think we need a lot better options.
Yeah.
If you think about it. So what really frustrates me is if you look at erectile dysfunction. There are so many treatment options for erectile dysfunction on the market. It can affect men, doesn't affect every man. But there's so many drugs, there's so many options for them. There's so much research that goes into erectile dysfunction, and endometriosis is just left behind, trailing behind. Endometriosis affects nearly as many people as diabetes affects. Diabetes gets all of the research funding compared to endometriosis. It is shocking how little funding goes into menstrual health conditions, and something needs to change. I do feel that if men had endometriosis and were affected by endometriosis, we would have a cure by now. And yes, there's very rare cases where it has been, people will say, but it has been found in men. But it's very, very, very rare cases that it has been found in men. You're not seeing men, one in 100 men come in with endometriosis issues. It's not. But if it affected men as well, I do think we would have better treatment options, if not a cure, or understanding the condition a lot better, which is, that to me is the most frustrating thing when I've gone in and researched endometriosis, about how little is known about it. And it was first discovered in, I want to say like in the 1700s. So if you think about it, it was first described by a doctor in the 1700s or 1800s, I can't remember. And we're still no closer to having a cure or knowing exactly how to manage it.
Yeah, it's absolutely ridiculous. I feel like something will only be done when it comes to the point where more and more women are being affected by it. And as a result, the birth rates are going down drastically, because at that point, there will be a problem of,
it starts affecting the economy, doesn't it?
Exactly.
Yeah.
Exactly.
And I feel like we're still stuck in the early 1900s with that. Is that we're still seen as to give birth. That is seen to be our reason to be on the planet, is to give birth. But like you said, only when it affects the birth rate will they go, okay, we need to do something about this now. Because adenomyosis, like I said, which is similar to endo, causes infertility. So, and they say adenomyosis affects 1 in 10 women globally. So if you think, and also adenomyosis can come on later on in life, and it will also get progressively worse over time. So if we're not protecting women's fertility at the very beginning, like I wish I'd been offered to freeze my eggs in my early 20s. I wish my condition had been identified as gynecological in my early 20s, because I could have done so much more to preserve my fertility. I could have had loads more eggs frozen. I could sort of know where I was with things. I might have made different choices and decided to have a family earlier, to have, to do that. But I've lost my choices now because I was left for so long. All my choices have been taken away from me, and it's been extremely difficult to come to terms with that and not blame the NHS for it, which I struggle a lot with. I do feel very let down by the different health boards that I saw, especially because everything I reported was consistent with endometriosis. But again, I don't blame doctors if they're not properly educated and taught about this. Or I think I heard that doctors only have to do around an hour of training on menopause. If they don't, if it's not something that they want to specialize in. An hour is not enough. That's going to affect something that is going to affect 50% of the population. An hour is not enough to learn about that, and they don't keep up with up-to-date research. You've got people like Louise Newson and Davina McCall shouting from the rooftops that things need to change, but we're still left left at the sidelines. Like I said, it has taken me over 3 years to see a menopause specialist on the NHS who is actually qualified to treat me, and to actually be prescribed appropriate HRT on the NHS. It's taken me 3 full years, and I've been left fighting and paying out of pocket. And prescriptions I was paying for at a time, like £350 a time. They're not cheap prescriptions either, because I need specialist care, because I went into surgical menopause so early, and I've also got endometriosis. So, not everyone is going to have specialist needs, but the ones that do, we're being left behind.
I mean, I know I don't want to say it like this, but for me, it almost feels like to any woman or girl that's going to be going out there getting a job at some point in their life, always look for a company that gives private medical insurance.
Absolutely. And ones that are dedicated to educating and raising awareness of women's health. I'm very lucky with my current employer, who goes out their way to educate people on different health conditions, not just ones affecting women, but men as well. But they have allowed me within my workplace to set up a women's health support community. So I go in and I share hints, tips, I share news articles, research, and just create an environment where people feel heard and feel less isolated. And the feedback that we've had from women and those assigned female at birth across the organization is like, I finally feel like I'm not invisible. I finally feel like what I'm going through, I'm not alone. And it is just having that one person who can understand and empathize with you makes all the difference. It makes so much difference. And I wish I'd had that growing up. And I had great support from female friends and family. However, they didn't know, because they're not trained medically to know what I was going through. And I really hope that now endometriosis and other menstrual health conditions are being spoken about a lot more. I really, really hope it makes that difference, that people are getting diagnoses earlier. People are talking about it. People are being educated in school. Like, I was not educated on, we learned about sex education. We learned about condoms and things and STDs, but we never were told about periods. And I remember being in school thinking, why am I the only one who struggles when I'm on my periods compared to all my friends? Why am I bedbound? Why am I crying in the toilets? Why am I just wishing that I could just, end it all right there and then? And it's horrible things to say, but that's how a lot of us feel, and we go through life experiencing things like that. And again, we're told to take some the amount of antidepressants I was prescribed through my journey. And I was just like, well, I'm depressed because I'm in pain. I'm not depressed, for I need help. And it's like, let's do everything we can to just mask everything else. And again, they only want to prescribe the drugs that earn their money as well. So it's very difficult to know, unless you go privately, to actually know how you should be treated correctly. And I've got to say, going privately, was the best thing I ever did for myself. I've been treated, every single doctor who I've met privately has treated me with the utmost respect, has not gaslighted me, has really understood everything and listened to me and listened to how it's affecting my body, and not just sort of going off their education. They actually listen to you. And we just need more of that in the NHS, and they are there. I know they're there because my private doctor works on the NHS.
Exactly.
I know they're all there, and I know they're capable of doing it. I just don't think we're doing it enough. And I think we need a re-education, and it's not just women's health, it's men's health as well. Men's mental health is not taken seriously at all. And you know, there's so many people who are being impacted by it, and we really need to advocate for better healthcare, I think, across the board.
Yeah, no, absolutely. Now, looking back with all the, things that you've been through, what advice would you give to women out there that have some symptoms, whether they're heavy periods or something else? What would you do differently now, knowing what you've been through and all the things you've learned? What would you do differently? If you rewound back to that 13-year-old girl, what would you do differently?
I would definitely have tried to be more assertive in my doctor's appointments. I think we just believe what a doctor says because they are the healthcare professional. They are the ones educated. I wish I was more clear and I was more confident in expressing what my concerns and my symptoms were. I wish I had not taken the first answer. And again, I don't blame myself for that because I didn't know that was available. I think you've got to be very conscious of the language that you're using in doctor's appointments, because again, women use very emotional language, and we are very articulate. We know how to describe what we're going through, but a lot of doctors just want to know very sort of like basic information. Like I was going in saying it feels like my whole stomach is being wrung out like a wet tea. The only way that you can describe it, like I would say, it feels like somebody is tasing. Like I've never been tased in my life, but this is what I feel like being tased would feel like. And being stabbed, twisted. So be very aware of the language you're using. Keep it very to the point, I think. There are also some amazing healthcare diagnostic toolkits which are free on the internet. So Menstrual Health Project, as one example, do diagnostic toolkits for menstrual health conditions, endometriosis, where you can track your symptoms. Use that as a guide, and you can also take that into doctor's appointments. So GPs, I think, are becoming more receptive to these toolkits because it kind of takes out their, fact finding for them, and you can just go and present it and say, these are my symptoms at these points during the month I experience. These are how they affect me. These are my pain levels. And I just think there's, it will help you understand your health better, but it also help your healthcare provider manage you more effectively if they've got the information right in front of them. Also, I would prepare questions before doctor's appointments. So anything that you're concerned about, write it down, write everything down. Because when you get into an appointment, everything slips from your mind, especially if you're not feeling that level of pain. Because this was one of my things that I found difficult, was when I wasn't in pain, it felt very hard to then articulate what I was going through to a doctor if I was feeling okay. So it was like I needed to feel that pain at the time. And then obviously, because I've been gaslighted so much, I was doubting myself. So every time I had like a good few days, I think, am I just making my pain up? Is this just not, is this just something that, I'm not dealing with very well? But then a few days later, it would come and like knock me for six. So it's really difficult. Make sure you have support. So make sure you've got a trusted friend, family member who will support you, and take them with you to doctor's appointments. It shouldn't be the case that you need somebody there to back you up and reiterate what you're saying. It's disgusting that is the only way some of us get listened to. A lot of people who I have helped through my support page and have come to me saying that the only time they were listened to was when they took their husband or partner into the doctor's appointment and they told how they were negatively affected by their partner's condition, and that was the only time they got listened to. And that is shocking to me. I know I think I took my sister to a couple of appointments with me to back me up, and again, doctors didn't listen. I never took a partner with me. But yeah, take somebody with you, because also having that support for you emotionally will make you feel better as well, I think.
Yeah.
And also document everything. And I mean everything. Like, keep a daily diary and say, you know, pain levels out of 10, like, do it, have your own, and don't worry about the doctor's chart for pain levels. Do it off your own back. Mark down what your pain levels mean to you. Say what your symptoms are. You know, you can track your diet with that as well. You could track everything. Just use a diary and just note down absolutely everything, so nobody can say, you know, you've got all your evidence right in front of you. And educate yourself. Go out and read as much as you can. There's some amazing advocates all over social media, on Instagram, Facebook, Reddit. They are there. And you need to find them. And also, don't listen to these quick fix, quick cure people, because there is no cure for endo. So no matter how much somebody tells you some green powder cured their endo symptoms, or their change in diet eradicated everything, everyone is different. So not everything is going to work for everyone. So somebody removing gluten from their diet to remove inflammation may be fantastic for one person, but for another person it might make no difference. So sometimes I think that the endometriosis community is an amazing tool, but I think it can also make people feel like they may be failing sometimes if they see somebody doing something who said, I've completely got rid of all my symptoms, I live an amazing life. People are going to go, well, why can't I live like that? And I know personally, I've tried literally everything, and nothing apart from the total hysterectomy has done anything to my pain levels. But like I said, now it's been 3 years later, I still suffer from chronic pelvic pain. I've got a hypertonic pelvic floor. I've got adhesions and scar tissue all over my digestive tract. My small bowel is currently being adhered to the top of my vagina. I'm going to need more procedures to see what's going on, and I probably will need another surgery, because all of this points to my endometriosis being back. So I think people need to don't beat themselves up about it. Like, this is an awful, awful condition. Like we spoke about earlier on, it is life impacting. It impacts every part of your body, every part of your life. So be kind to yourself, because it's difficult. It really is. And just make sure you have somebody who you know that you can talk to, because it's extremely isolating, there's been times where I've sort of locked myself away and not spoken to anyone. And it wasn't until I found the endometriosis community that I finally felt understood, and not alone anymore. And I think it's very important to get that support system around you.
No, absolutely. I think the key thing, you know, that you said is do not under no circumstances start listening to everyone's miracle cure, because that is the worst thing you can do for anything that you're going through, whether it's endometriosis or you know, whatever you're going through. Do not listen to anyone's miracle cure. This is about you. Listen to your body, and all the advice you've given is absolutely fantastic. And there are groups, and I really believe in the power of community. Find your tribe, you know, find those people that are going to support you, or
and build you up and lift you up through it as well.
Exactly.
You know, do need those people.
Yeah. Well, thank you, Amy. Thank you so much for really delving into your journey. It's been a pleasure, and I really appreciate all your time and effort that you've put in to go through everything in detail.
Yeah, no, thank you so much. And like I said, it is, you know, it's very complicated talking about these chronic conditions, because they impact everyone so differently. And even though a lot of our journeys are very similar, they're also very personal and very different as well. So I think it's just, let's all be empathetic to each other, be kind to each other, and just make sure that we're supporting and lifting each other up.
Yeah, absolutely. Thank you so much, Amy.
Thank you. Appreciate it.